we said that pregnancy should be taken very good care of. And that way today we want to talk about the danger signs that when you notice them in pregnancy, you should seek immediate medical attention. We have around 9 that I will touch on very fast to at least give you an idea of what you should expect while you're pregnant and what you should not expect while you're pregnant. Danger number 1, it's pervaginal bleeding. There is a very big difference between vaginal bleeding and vaginal spotting. Vaginal spotting usually occurs within the very first 2 weeks after pregnancy, because this one it's usually associated with implantation. When the fertilized egg, or in other words the fetus, is attaching itself into the walls of the uterus, we expect some spotting to happen. But when we talk of bleeding, this is bleeding that can be noticed, bleeding that can need you to be on your sanitary towel. That one should not be taken normal, and you should seek medical attention. There are 2 main causes of vaginal bleeding when you are pregnant. Number 1, we have a condition that we refer to as abruptio placenta. Abruptio placenta is the situation whereby the placenta detaches itself from the walls of the uterus. Normally, the placenta should attach into the walls of the uterus throughout the pregnancy. But when this placenta detaches itself from the walls, then that's what we refer to as abruptio placenta, and it causes bleeding. Number 2 cause of bleeding is placenta previa. Normally or ideally, the placenta should be on top of the fetus. What happens with the placenta previa, instead of this placenta being on the top, it goes down and closes the opening of the uterus, or what we refer to as the cervix. So when the placenta is below, or in other words, it's in the opening of the uterus, that's what we refer to as placenta previa. The reason for you to get checked in case you have placenta previa is because you cannot give birth normally. Women with placenta previa ends up delivering through a cesarean section. Number 2 danger sign, it's convulsions, or what other people refer to as fits. Convulsion, I will try to define it as sudden loss of consciousness and the body control. When you have convulsions, many people experience frothing. Some people can even urinate on themselves, and others can even end up defecating on themselves. So if you are pregnant and you experience any episode of convulsion, you should seek medical attention immediately. Number 3, we have body swelling. Many people might need to negotiate on this. They expect that body swelling during pregnancy it's normal. The only part of body swelling that we can negotiate as normal is when you experience swelling on your feet. But when this swelling becomes extensive, you experience swelling on the hands and you experience swelling on the face to a point of you cannot open your eyes, or when you have swelling on your hands you cannot even bend your fingers, then that swelling you should seek medical attention immediately. Why should we seek medical attention if you experience swelling? There is a condition we refer to as the pre-eclampsia or eclampsia, or if you have high blood pressure. People with eclampsia or preeclampsia present with body swelling. So if you have this condition, then you need to be checked very fast, because this one is a killer disease among women who are pregnant. Number 4, we have severe headaches. Yes, we expect pregnant women to experience headaches because of hormonal changes. But if it happens, these headaches get worse with the time and it's severe, then that one is not normal. Especially we say if you are experiencing headache on one side of your head, we refer to it as temporal headaches. You persistently experience headache either on your right side or on your left side, just above the ears, then you should consider seeking medical attention immediately. Number 5, we have abdominal pains or abdominal cramping. Abdominal cramping should never be taken as light as people tend to think. We only expect you to experience abdominal pains when you are in labor. If you are not in labor and you experience abdominal cramping, you should immediately seek medical attention, because this might be due to either urinary tract infection, or it can be a sign of early miscarriage or abortion. If by any chance you experience abdominal pains, then you should seek medical attention. And this one, I will tell people not to confuse abdominal pains with something that we refer to as the Braxton kicks. Braxton kicks tends not to be so painful as the abdominal cramping. So by any chance you experience lower abdominal pains that is migrating to the back, then you should consider seeking medical attention immediately. Number 6 is dizziness. Because of some hormonal changes, we expect you to experience dizziness. But if this dizziness is so severe to a point of when you stand up, you cannot even stand without support, or you notice like the place where you are standing is like something is going round, or let's see, you are rotating, like some form of vertigo, you should immediately seek medical attention. Number 7, we have palpitations, or in layman's we say the racing heart, the fast beating of your heart. The palpitations happens when your heart is beating to a point of you can feel it. Then you should also seek medical attention, get your blood pressure checked, also get your hemoglobin levels checked. Number 8, and this is the most common, is the reduced fetal movement. When you are pregnant and you are from 20 weeks, then your child, you should still already start feeling your child kicking. So if you're pregnant and you are above 20 weeks and there is no fetal movement, you should immediately seek medical attention without wasting of time. Because one sign of the intrauterine fetal death is absent fetal movement. Fetal movement is like a sign of telling you that your child is doing well in your womb. If you notice there is no fetal movement, then you should check, or you should seek medical attention immediately to ascertain that your child is okay, that your child is alive, and that your child is not in any distress. In your third trimester, we expect some reduced movement because the uterine space is largely occupied, and your child might not be having enough space to kick or enough space to move. But this one does not mean that you should spend weeks without feeling any fetal movement. And number 9, which is the last, is the body weakness. We say that pregnancy is not a disease. Within being pregnancy, this one should not limit you from doing your normal day activities. So if it happens in the morning, you try to wake up and you cannot wake up because of the body weakness, then you should consider seeking medical attention immediately. So all this having been said, please try to track your pregnancy journey. If it happens to experience any of these danger signs, you should seek your medical attention immediately. To all my pregnant mothers who are viewing, I wish you a successful pregnancy journey and a safe delivery. If this is the very first you are coming across this video, kindly consider to subscribe, click the like button, comment and share. Until the next video, I sign out.